Well, we're going to start part 4, medical legal issues, and we're going to talk about consent. Well, consent is what we need to render care to our patients. It's not acceptable or good enough legally for us to just walk up and start providing care. Under most circumstances, it is required from every conscious, mentally competent adult before care can even be started. So if your patient's alert, rational, and capable of making informed decisions, he or she has a legal right to refuse care or consent to care as well. So make sure you take time and make sure you have permission before you even lay hands on the patient. So there's different types of consent out there. And the type of consent that you're going to utilize to provide care has certain criteria, and we're going to go over those. So expressed consent. Now this is a type of consent that is utilized when a patient demonstrates permission to provide care and or transport. For this to be valid, the patient must provide informed consent. So that means that you have got to explain what you're going to do to the patient, what treatments you're going to give them, what medications you're going to give them, and explain the potential risks that the procedure carries. So before you can even touch the patient or begin to treat, you have to get this consent. So to provide informed consent, the patient must be of legal age and able to make a rational decision. So that means they need to be A&O times 4. And the patient must agree to certain emergency care, but not other. Or the patient can agree to certain emergency care, but not others. So that means that if the patient does not want an IV, but they want transport, well, then you cannot forcefully start an IV on them. You have to abide by their wishes. However, you need to document that. And in some organizations, you would then do a refusal form just on that aspect of care, which is a good practice. Now, it doesn't mean they're refusing transport, but you might need to get a document that they sign that says, hey, I refuse to have an IV administered to me, so that it can't come back to get you. So implied consent. Implied consent comes into play when you have an unresponsive patient, a delusional patient, a patient with altered mental status, or a patient that's otherwise incapable of making an informed decision, like they may be under the influence of drugs or alcohol or so on. So this is limited to true emergency situations. All right, just because someone is intoxicated doesn't mean you can drive up and force them to be transported to the hospital. There has got to be some type of emergency situation present. Now, you can look and see that there could be some legal gray areas here, so you want to make sure you document everything appropriately so that everything is covered if you were to be called in because the patient accused you of false imprisonment or kidnapping or so on. So if a spouse or a relative is there, try to get consent from them, because at least now you have a witness or a family member that said, yes, I wanted them transported to the hospital. So refusal of care may also be implied. So implied consent no longer applies if patient regains consciousness or appears capable. So let's say you have a patient that is diabetic. Well, you now have implied consent because they're unconscious, their blood sugar is 30, they need D50 or glucagon administered. So you start an IV, you give them an APA D50, well then they wake up and now they can refuse care. So what about children? So parents or legal guardians will give consent for children. So if you have a child there, you need to get the consent from the parent. So in some states, a minor can give consent depending on the age of maturity, whatever the age of maturity is. If they're married, pregnant, or emancipated, they may be able to. And minor parents can give consent for their children as well. So those are some situations where minors can give consent. It gets hairy, and sometimes you may want to make sure you document very well the entire circumstances. So whenever possible, you want to obtain consent. Always in non-life-threatening situations, you want to get a consent. If it's a life-threatening situation and the parents are not around, let's say that the child ran away from home and now they're injured and they're hurt, well, then you just can't leave the child there. Now care is implied. You take them to the hospital, and then we can get the parents. So if there's a true emergency and no consent's available, treat the patient, because, like I said, consent is then implied. So involuntary consent, this applies to patients who are mentally ill or in a psychological crisis. They're under the influence of drugs or alcohol, and they're developmentally delayed. So this is, a situation, again, that you need to make sure you have backup documentation. If they're mentally ill, you need to try to document what the mental illness is and what they are doing that requires medical care and requires you to bring them to the hospital and provide care to them. Same thing for your behavioral, and same thing for under the influence of drugs and alcohol. Now, I'm real leery of not transporting a patient who is under the influence of drugs and alcohol, especially if there's a medical condition there that we were summoned to. So let's say you have an alcoholic who has been drinking, and he's been drinking pretty heavily for some time, and he's now having chest pain. And when we get there, if he's refusing care, well, then it doesn't matter. He's under the influence of alcohol, and he's going to the hospital at that time. Mentally incompetent adult patients cannot give informed consent. So this could be your Alzheimer's patient or your dementia patient. So in this situation, you want to get consent from the guardian or the conservator. So if for some reason it's not possible to get consent from them, well, then you need to document exactly why and what's going on and why you need to transport this patient to the hospital and the circumstances surrounding it. So if you have a dementia patient who escaped from the nursing home, and he's been out, and it's now 3 o'clock in the morning, and it's 20 degrees outside, and he's hypothermic, but he's confused, well, then that's an involuntary / implied consent there. So we wouldn't just leave him there, even though if he was refusing care, because he doesn't want to go back to the nursing home. We're still going to take him. Now we're not going to take him back to the nursing home at that point. We'll take him to the emergency room so he can get treatment and so on. So this is a quick overview of the consents. Make sure you read this good, because I can guarantee you there will probably be some questions regarding consent on your national registry and on an upcoming exam. So our next section will be part 5, and we'll be talking about forcible restraints in that section.